the Allergan recommended dilution. And at the end, I'm going to give you a couple of do's and don'ts. Let's get started. All you need is your 100 unit bottle of Botox, a 3 cc syringe, and some bacteriostatic saline. Make sure you clean the rubber stoppers with a 70% alcohol prep because the manufacturer does not guarantee sterility of that rubber stopper. Allergan recommends a reconstitution rate of 2.5 cc's for 100 units of Botox. Protocol requires us to pull up 2.5 cc's of air to inject into that bottle of saline to make it easier to do the withdrawal. Turn the vial upside down and begin pulling out that 2.5 cc's. It helps to pull just a tiny bit extra into the syringe, just a small amount. Don't worry, we'll get rid of what we don't need in the next step. Then release the air bubbles by gently tapping it, and then push it back up to the 2.5. Remove the syringe from the saline vial, pick up your bottle of Botox, and look for that central circle on the rubber stopper. That's where you'll insert your needle. Steady your hand by placing a finger on the vial as you insert the needle in that central circle. The Botox vial comes with a partial vacuum that should start drawing the fluid into the vial. Make sure you push the remainder of the saline inside the bottle so you have full reconstitution. Don't remove the syringe just yet. Grab hold of the hub of the needle and disengage the syringe and leave the needle inside the vial for just a moment. Now go ahead and remove that needle. That will release that partial vacuum, and it'll make it a lot easier for you to withdraw subsequent volumes from the vial without having too many bubbles. Now you should invert and rotate the bottle gently. There's no need for vigorous agitation. The bottle's now ready for you to pull up your patient doses. Now for the do's and don'ts. Each and every time you're going to access a multi-dose vial to withdraw fluid, you must pre-inject that vial with an amount of air equal or greater than the amount of fluid that you're going to withdraw. When you omit this step, you make it very difficult to pull up volumes that don't contain air. In fact, I've seen injectors pull up an entire syringe filled with air and didn't realize there was no liquid in it. Now let's move on to the don'ts. Never leave a needle inside the rubber stopper and just unscrew the syringe and do multiple syringe changes thinking you're doing the patient a favor by not dulling the needle. This is a hard and fast breach in sterility because you can introduce bacteria into that vial by doing this. Another breach in asepsis is by removing the rubber stopper and just going in and out of the bottle for multiple patients with the syringe. An open vial is open to contamination, and the longer it's open, the greater the risk. And you can see that touching the inside of the vial with your syringe allows capillary action to grab any bacteria sitting on that syringe barrel and enter the vial. The only time this is acceptable is when you're down to your last few units that you want to retrieve, and you will not be treating any other patients out of that vial. That has to be executed very carefully because you cannot touch the rim of the vial with your syringe since your syringe in that area is not